Courtney from Plymouth has a question about sleep talking, wondering about what the causes are. The interesting thing about sleep talking is it's extremely common. It almost always means nothing. Whether or not you can rely on that information to present to a jury, highly unlikely. But there are cases you do need to know about. That is in the area we call the more significant parasomnias. So for example, people that sleepwalk may also sleep talk. But the place where they're going to get in most trouble, assuming they're not revealing state secrets when they sleep talk, is that the sleepwalkers who are more active tend to be the ones that get more commonly injured. And that's when sleepwalking becomes dangerous. Thus, if somebody is doing more sleepwalking, more sleep talking, more activation or movement of their body during the night, that is the sign where we would be a little bit worried about this particular parasomnia. Another common one, as we've talked about before, is REM behavior disorder, where people act out their dreams. We're seeing this in increasing frequency in our sleep center, and oftentimes it can be related to patients using antidepressant medications, which can actually trigger this response to act out dreams. Now, taking that all together, the most important thing I can tell you about sleep talking, sleepwalking, REM behavior disorder, and so forth, is that a large proportion of these patients have, you guessed it, sleep apnea. And when you treat the sleep apnea, you often see a great deal of these movement conditions or the talking or even the acting out of dreams dissipate, completely go away in some cases, or markedly reduce. So there are a number of causes for sleep talking, but in general, sleep talking is benign.